Okay, good afternoon, everybody. Thank you for joining us today. This is the information session for the online Bachelor of Science in Nursing, RN to BS program. My name is Tracy Souza. I am an enrollment specialist here at UMass Dartmouth. And joining me today is Weta Dowd, who is the clinical assistant professor in the RN to BS program coordinator. And also with us today is Michelle Bourgeois, who is the student support coordinator. This information session is being recorded. If you have any questions, we ask that you put them in the chat and we'll go through your questions at the very end. And so let's get started. So today's session agenda, we're going to go through the introduction to online learning. Then we'll provide you with an overview of the program. We'll provide you with admission requirements, how to finance your education. We'll give you some helpful resources. And then again, we'll do that question and discussion at the very end. So why choose UMass Dartmouth? So UMass Dartmouth is ranked top 10% in the nation for Bachelors of Science in Nursing programs, and that's ranked by US News and World Report. We're also ranked 4th among public universities for best Bachelors of Science in Nursing programs in Mass, and 6th in New England. Again, and that's by US News and Report. And we have started 24/7 online tutoring with live tutors. So we do have asynchronous learning. So what is asynchronous learning? Well, that is you learn on your schedule. So you will have some recorded lectures, but you will follow the syllabus and you'll use different platforms. We'll use the Canvas platform. Sometimes we have discussion boards with your virtual classmates. We'll have websites, blogs, emails, videos. So you decide when you want to watch the lecture or when you have time to post on the discussion boards. As long as you have a Wi-Fi signal, you can manage your time accordingly. I do want to point out that the same faculty who teach on campus, they also teach on these platforms as well. And it's the same faculty who teach on campus also teach online. So what are the advantages of UMass Dartmouth? So again, we have practicing faculty who provide cutting edge knowledge in the field. We have dedicated student support. Again, we have the 24/7 online tutoring resources. We have online asynchronous courses that allow you to manage your time. And then we have multiple program tracks. So if you can do the RN to the BS in nursing, and then if you are in the RN to BS and you're doing well, you can talk to your advisor about going into the MS and taking an accelerated program that way. It allows you to take some MS courses while you're still in the RN BS program. We do have an MSN program. If you have a bachelor's in any major in an RN license, you can get into the MS program. And then we also have a BS to DMP program. And that is for people who have an RN license, like an associate's in an RN license, and they also have a bachelor's in any other major. You can take the pathway into the DMP program, and there's the gerontology or the psychiatric mental health. So we do have several different online tracks that you can take. So I'm going to hand it over to Michelle Bourgeois, and she's going to pick it up from here. Michelle?
Thanks, Tracy. Thank you for being with us this afternoon. My name is Michelle. I'm the student support coordinator. So pretty much I am here to help support you on your academic journey from the start to the finish of the program. I will be able to give you any types of resources that you need, whether it's on campus or off campus, connecting you with the different departments. If you have a question, I welcome questions all of the time. So I'll make sure that you get what you need if I don't know the answer. I also will assist you in your course enrollment for your nursing courses. We like to make this process as easy as possible so you can just focus on your coursework. I do understand our population of students very well. I myself has also taken online courses and worked full-time, so I can definitely relate with my students and offer any types of motivational support. And like I said, any questions about university processes, I'm here for that to help direct you to make sure that you get all of your questions answered. And again, that motivational support, we understand that life isn't always easy, and we're here to work with you. If you have any questions, concerns, our professors, our program coordinator, director, Professor Dowd, her and I and our professors all work very closely together to make sure that you are supported throughout your time here. Next slide. So why earn a bachelor degree in nursing? For the majority of our students, for career advancement. So this is going to provide you the opportunity to hold leadership positions and assist in research and understand the why theory of patient care and nursing needs to deliver quality care. That's very important to us. And we strive to help our students understand that. Also, educational advancement. So we have direct pathways that Tracy had just mentioned to earning your master in nursing, the MSN, and doctorate in nursing practice, the DNP program. Or if you're interested in the PhD in nursing, we have those pathways as well. And here is a slide that shows you about the multiple program tracks for these pathways. So the RN to BS program, number 1, then MSN program, or if you want to do the BS to DNP, we have that pathway. And again, RN to BS to MSN program. So students that are enrolled in the RN to BS program that wish to continue on to the MSN program, we do have a way that you can take master's courses at an undergraduate rate. So that's something to consider if you want to pursue your education further. Next slide. Accelerated online programs. So here we go again, start a master's degree while earning the bachelor degree. That's what I was just mentioning about when you're in the RN to BS program. The benefits, you can take up to 3 graduate level nursing courses, which is 9 credits, while pursuing your BSN degree. You apply to courses for both degrees, so you'd be in the bachelor level, but taking the master's level courses. So that's the benefit. You're kind of like double dipping in a sense. You're going to get credit for your bachelor degree, but also for your MSN degree. And you're going to be able to pay an undergraduate tuition rate for up to 9 credits. And you complete the master's program when you're ready. There's no commitment to continue. So that's a great way to help of our students to kind of get your feet wet into some graduate level courses while you're in the BSN program. And I'm going to hand this over to Professor Dowd.
Thanks, Michelle. So glad that all of you joined us today. It's nice to see you here. I am the RN2BS program coordinator. I've been in this program for quite a while. So I'm going to run through what it is you need to apply to the program. Students need to have 121 credits to graduate, but that doesn't mean you have to take all of them on top of what you've already taken. It means that you get a 45 credit professional portfolio transfer credit when you come into the program. In addition to that, if you have other non-nursing courses, history, sciences, things like that, you can transfer all of those to us, and that will add up to those 90 credits. So if you have all of those credits, you would have to take 9 nursing courses at UMass Dartmouth for 28 credits and 1 non-nursing course a 3-credit course at UMass Dartmouth to get your degree to make that 121 credits. Next slide, please, Tracy.
Oh, hang on. I don't know what happened here. I just got, 1 second.
And when you work in the online world and you learn that sometimes things happen and you just have to punt. I think the next slide is our breakdown of our courses.
I lost my mouse.
Uh-oh.
Breakdown of our courses. I'm trying to get there.
Yeah, I don't have control of it. I'm sorry.
Let me see if I can get over one. I apologize. Trying to get here. Oh. One moment. Okay, I got it back. I apologize.
No worries. So non-nursing requirements for those transfer credits would be that are going to count towards your bachelor's degree at UMass Dartmouth, that 121 credits, include fundamentals of statistics, English 101, English 102, Psych 101, General Psych, Soc 101, 2 social sciences, something like abnormal psych or child psychology, human A&P 1, A&P 2, and microbiology, philosophy, and 2 humanities. And humanities can be languages or history, and then an elective, which is any course. So those help add up to that 45 plus credits you need to meet the 121 credits for graduation. Next slide, please, Tracy. So these are the RN2BS courses. There are 9 of them for a total of 28 credits. Students start out with NUR 301, which is transition to baccalaureate nursing. And NUR 306 follows that, which is talking more about the development of professional nursing beyond the associate's degree. The next semester, students will take either NUR 214 or NUR 302. 214 scholarly inquiry is about looking at the research that forms the foundation of our evidence-based practice and how we analyze that and use it to move evidence-based practice nursing forward in practice so we improve patient outcomes. NUR 302 is about advanced abnormal pathophysiology. It's about disease processes, some that you may see in practice and some that are very uncommon. It's about developing the critical thinking and a way of looking at disease processes and management. And then students would either take NUR 322 or NUR 328. NUR 322 is holistic health assessment for nurses, and it uses a simulation platform to advance your knowledge of systematic physical assessment of patients. But it's not just the physical assessment, it's the overall assessment of patients and how we put it all together to advance your practice as nurses. NUR 328, population health nursing, has a small experiential component to it. That's why it has an asterisk after it. And what that means is that your classwork is all online, but then you go into your own community and you evaluate your own community. So as a population, what are the needs of that population? What is missing that your community needs? You might talk to a couple of key stakeholders in the community, the public health nurse, the town nurse, something like that. And then you identify an issue that could be improved for that community, and you create a project to do that, and you present the project in your class. And then the last three courses, back to the last slide, Tracy. Thank you. The last three courses, NUR 410, is about healthcare informatics. It's not just about electronic health records and that computer we have between us and the patient. It's about what goes on to drive those systems and how we use big data, how we use the data we collect, how we secure the data we collect, and how we communicate that data and how accurate those health records are. So it's looking at the bigger picture, which then helps us as nurses to be able to be practicing at a more advanced level with electronic health records. NUR 452 looks at people with chronic illness, but it's not about looking at the disease and planning treatments for the disease. It's looking at the psychosocial aspects of being chronically ill in today's society and battling the complexities of our healthcare system. And the last course is NUR 409, Leadership in Nursing. That's the capstone course. It also has an asterisk after it because it has a small experiential component to it. All your learning is done online, but students identify an issue in either healthcare delivery or healthcare access that they want to address in this course. It might be from one of your earlier courses. Could be from NUR 214 or 322 or 328 or any of those courses. And then students develop a project to improve that healthcare access or delivery and actually implement it either in a community setting with their faculty advisor or in their work setting with permission of their manager and guidance from their faculty. Next slide, please, Tracy. So this is what the breakdown of courses looks like per semester. The normal course load for a student, depending on their life circumstances and how many hours they're working, could be 2 courses a semester or 3 or even 4. Students usually complete the program in 3 semesters, but they could do it in 2. I've never had anyone do it in 1, thank goodness. That's pretty intense. But I have had students do it in 2 semesters. So for a normal load, 2 courses a semester, the first semester, students would take NUR 301, followed by NUR 306. Our courses are 7-week courses, and our semesters are 14-week long. So you can see that the students would take 1 course at a time, one the first 7 weeks and one the second 7 weeks. And then the second semester, it'd be followed by 2 more courses, same with the third, the fourth. And in the 5th semester, that last course, the capstone NUR 409, is a 14-week course because students actually develop and implement a project to improve healthcare access or healthcare delivery. And creating change takes a little bit of time. And so students have always said that they needed that. They didn't think they needed, but they definitely needed it. And that's where they really experience that change in being a baccalaureate prepared nurse and how much they've grown since they got their associate's degree. So it's well worth the 14 weeks. Students also have to take that non-nursing elective. They could take it in the summer between the semesters, or they could take it that last semester with NUR 409. Next slide, please, Tracy. So students who want to go through the program more quickly, like I said, I've had students complete the program in 2 semesters. We run our RNWS courses primarily in fall and spring semesters. And then summers are devoted to completing non-nursing electives needed to meet that 121 credits if students didn't transfer all those credits in. So somebody that wants to fast track, get through the program in 2 or 3 semesters would be taking 3 courses a semester. So in the last slide, I showed you 1 course each 7 weeks. In this slide, I'm showing you what it might look like if someone was taking 3 courses a semester. So they would get through those courses pretty quickly. Next slide, please, Tracy. And it's all back to you.
Thank you. All right, so I just want to go through the enrollment process just so you have an overview of what it's going to look like. So after you would apply online, then you're going to submit your application documents. You would get, for example, if you're admitted, you'd get an admission letter. And then after the admission letter, you have to fill out what's called the intent to enroll form. A lot of people think that once they fill out that intent to enroll form, that they are committed to UMass Dartmouth, but that's not the case. So the intent to enroll form just pushes all your documents over to the department, and we can look at what transfers. Michelle's going to look at what transfers, what doesn't, so she knows what she can enroll you in. Then you're going to schedule an appointment with Michelle, and she's going to go through all of that. She's going to create a personalized education plan. She's going to help you select your courses, and she's going to register you for courses. And please keep in mind that when you get registered, it doesn't mean that your tuition is due at that very moment. So you'll get access to what's called the COIN side of thing, which is the academic side of things. And in there, you will see your invoice. Typically, it shows up about a month after, but you'll get a notice. You'll get an email telling you that you have an invoice, and then you can look at it. But you're not expected to pay it as soon as you register for courses. So if you forget any of these steps or anything, you're not sure what's next, you don't have to worry about it, because as the enrollment specialist here, there are 2 other enrollment specialists, and we're guiding you through the process every step of the way. So if you forget something, don't worry. We are there to remind you and help guide you through it. So what's needed for the admission requirements? So again, if you're ready to apply, you would just go online here to the UMass D online page, and you're going to see an icon down the bottom, like a tile that says ready to apply. You select that and you start your application. Typically, you need to set up an account first, and then you get access. We do have rolling admissions. So if you start an application and you submit it, but sometimes life gets in the way and you are not able to complete it in that semester, we will reach out to you and we will ask you if you want to move it to the next semester. So everything that you started is not lost, and you can certainly do that. You will need to submit official college transcripts. So again, once you submit your application, you're going to reach out to all schools that you have attended in the past, whether you earned a degree or not, and you are going to ask for official electronic copies of your transcripts to be sent. And once they are sent, they automatically upload to your application. And again, you will get access to an application portal where you'll be able to track all of this. You'll be able to see what transcripts have arrived and what has not arrived. You cannot upload official transcripts yourself, because then they're not official. We have to use like a clearinghouse. So you just go on, but all the schools use it now. So you just reach out to that college that you have attended in the past, and you should be able to do that with no problem. You will need to upload a copy of your RN license. So once you get into your application portal, you'll be able to see that there's an area where you can upload documents yourself. So things that you would upload would be like a resume, a statement of purpose, your RN license, anything like that. So you can upload that yourself. And if you don't do that, then we can typically find it through the Massachusetts, licensure website. We can find it there. And you will be asked at that point to pay an application fee. I'm going to give you a code at the end of this. If you stay online till the very end of this information session, I'll give you a code that will waive the application fee. And then for any of our international students, you're going to have to also submit a copy of proof of English proficiency. And we do that through the TOEFL, the Duolingo, or an IELTS. So you'd have to take those exams. And then anybody that has transcripts from outside of the United States, you would have to use a professional credit evaluation service. And we suggest that you use CED or WES, and they will provide a detailed breakdown line by line item of the class you took in your foreign country, and what that equates to in the USA and what that grade would equate to. That way we are able to see what will transfer and what you still need to take. So let's talk about the tuition and fees. How are you going to pay for all of this? So I just want you to know that the tuition and fees, they break down to $497.50 per credit. So however many credits you need to take, you just would times that by the amount of credits. So you can break down approximately what you're going to be paying each semester, and then again, what your overall cost would be. So again, how are we going to finance this? Well, we encourage everybody to fill out the free FAFSA form, the financial aid form from the government. And if you need assistance with that, you can go on to this website here, our financial aid website, and then go into applying for aid. They will assist you with that. Sometimes you can look and they'll have little tutorials about how to fill out the financial aid, like information sessions and stuff. I can tell you, I filled it out several times in the past. The first time I filled it out, it seemed daunting to me, but then, once you watch an information session or find out about it, it's really not that hard. And then the second time it's easier, and it gets easier as you get more comfortable with it. We do offer payment plans. So again, I talked about you're going to get a notice when you get your invoice. You can log in and you can see your invoice, and it's going to give you an option to pay it all at that time, or you can set up payment plans where it takes the cost of the semester and divides it out over the months of the semester, and you would just pay monthly. Please keep in mind, if you do that, though, you have to pay off one semester fully before you're allowed to start another semester. For anybody who's a veteran, we have veterans educational benefits you can look into. I would suggest that you reach out to your employer. A lot of time, employer has tuition reimbursement benefits. There's a website here. You can look into nursing scholarships. You may be able to take advantage of that. For anybody, we do have corporate partnerships with South Coast Health, Mass General Brigham, and Amazon. So if you work for any of those companies, it's going to ask you that in the application. If you select yes, you're going to be able to take advantage of a 10% tuition credit. And then anybody who's coming from an associate's degree, who graduates from a Rhode Island or a Massachusetts community college, and you have a grade point of 3.0 or higher, and then you enroll in classes at UMass Dartmouth within 2 years of earning your associate's degree, you can get a 15% tuition credit. And that is not just one time. As long as you maintain that 3.0, you can get that 15% tuition credit for up to 4 years. So I need to mention that anybody who's eligible for both of these, like you work for a corporate partner and you have Success by Degree, you're only able to take advantage of one of these. We will automatically apply the one that provides the highest tuition credit for you. So we do have this, it's called HRSA Health Workforce, and it's from the Bureau of Health Workforce strengthens the health workforce and connects skilled healthcare providers to communities in need. And they offer scholarships and loan repayment to students and clinicians. So if you are interested in that, or you may want to look into that, they may be able to provide you with some kind of, monetary benefit for you. And then last, we have keeping in touch. So if you need to reach out to our department or you have a question after the fact, this is our main admissions line. You can send an email here, or we always have somebody on the phone from 9 to 5, Monday through Friday. This is our main number. If you call that main number and you already are in our system, the receptionist answering the phone can find out who your enrollment specialist is and can connect you with us directly.